So, hi everyone. Thank you for being here. I am Cindy, and this is my colleague Régine. Today we'll be talking about transgenerational trauma in regards to family constellation therapy. And so a little bit about me. I'm an educator. I work with adults in universities, professional schools, and I am a student at McGill University, but also a family constellation facilitator.
And I'm Régine Titus. I'm a psychotherapist in private practice. I've been in the mental health field for over 20 years, but in private practice for the past 4 or 5 years. So when we talk about intergenerational trauma, it always brings us back to major traumatic events like slavery. We are presenting the story of Richard Roe, which is a fictional story, as a reflection of how the past trauma may be impactful today for Black Canadians. Richard Roe's ancestors were enslaved, brought to the Caribbean on slave ships in the 1700s. This is where the story of trauma begins. His ancestors lost everything. They lost their language, their culture, their family. They were brought to a new land or all by themselves. Many generations were born afterwards in the Caribbean. And the story of Richard Roe starts in 1964 with his birth. He immigrated to Canada in 1990 at the age of 26, got married in 1995 and had a daughter in 1998. Today, Richard Roe is 60 years old. Intergenerational trauma, the definition as the APA, is the transmission of trauma or its legacy in the form of psychological consequence or an injury or attack from the generation experiencing the trauma to subsequent generation. And I just want you to pay attention to the words like injury and attack. It's so violent. The transference or the transfer of this effect is believed to be epigenetic. Epigenetic is it's complicated, especially when we're talking about trauma. But basically the short definition is the trauma experienced by the older generation is translated into a genetic adaptation that can be passed on to successive generations. So from one generation to the next. The gene is not changed per se, but the expression of the gene is modified. In the case of Richard Roe, we know that untreated trauma, any type of trauma, family trauma, racial trauma, results in patterns of behaviors, thoughts, emotional reactions, attitudes, and even memories, which are impactful on the brain. These patterns may also alter the mechanism by which the gene is expressed. That's the epigenetic that I was talking about. What we know is that there is increased risk of health and mental health issues, including anxiety, depression, high blood pressure when the trauma is passed on. Richard Roe, so there's a wonderful author and therapist who wrote about she identified, I should say, her name is Tamara Hill, and she identified that those patterns leads to 6 outcomes that are here right now. And those outcomes are also indicators of intergenerational traumas in families. So we're not going to go through all of them just because of time, but I chose number 2, so emotional sensitivity. In the case of Richard Roe, emotional sensitivity, would be unregulated emotion. So the trauma reaction vary by generation, but can include shame, increased anxiety, guilt, helplessness, low self-esteem, depressions, suicidal ideation, dissociation, psychosis, and it's passed on. So it could come out in any way, we could say. And so if we take the untreated intergenerational trauma and the present day trauma, as we've seen during this whole presentation, the trauma is continual, right? It becomes very, very complex. And trauma work is really important. And if Richard Rowe was to come to my office, for sure I would use the different modalities such as EFT, which is emotional focused therapy, EMDR, internal family system to help him to address these traumas. We know that, however, we know that all those modalities can help, but they're not adapted for the Black community, especially not for the Black Canadians. So in IFS, in internal family system, and this is where, for us, I guess, we started asking the question about intergenerational trauma and family constellation. They describe trauma as energy, as trauma energy, and as a part, which makes it, you know what, we were talking about the complexity earlier. Now it makes it a bit smaller. It makes it as a part. And in IFS, there's, we're all made of parts, many parts, and that would be one of the parts. But if the trauma takes over, it can create a lot of damages. And in my office, I would address these issues personally with Richard Rowe. But family constellation would address the lingering generational trauma. So kind of working at a different level. In family constellation, trauma is perceived as harmful acts or life interruptions. And for Richard Rowe, we just highlighted the different interruptions or traumas or harmful acts, including slavery, loss of land, immigration, and that's all in his lineage, in his history. So I will let Cindy continue with how family constellation can be helpful for addressing intergenerational trauma.
And so before I start talking about family constellation therapy, I want all of you to open your minds, right? This is not a traditional Western method, but rather a method that asks of you to reconnect with this mind that you had when you were a child, where everything was possible, right? Where your imagination could make you travel, where your dreams could become true, but also where you could connect with your intuition so easily. We are not in a world where we're talking about these material things, just like I can touch this chair. Rather, I'm inviting you to try to see things from a different realm and to expand your mind in a different way. So now that all these scientifics in this room have been notified, I can go on with my part. And so if we take Richard Rowe, right? He is an individual, but through family constellation, we believe that he is actually part of a collective, which means that the trauma that he has inside of him, even though he's been through years of therapy, he's sought help, there may be little things that bothers him. So for example, he may have violent tendencies and he didn't grow up in a violent neighborhood. He wasn't exposed to violence or his parents weren't violent, right? So where does this violence come from? Well, family constellation therapy believes or theorizes that perhaps this belongs to one of his ancestors, because we see people as a collective, and therefore he is himself, but he is also parts of his parents, his great-parents, his great-grandparents, and so on. But it doesn't stop there. He is also perhaps what he will give to his children, their children, and so on. So if he doesn't make the decision through therapy or other alternative methods to heal whatever lingers inside of him, he may also transfer it to other people. And so this is a three-dimensional way to see the human being, right? It's a way to face and to see something that we may not understand. So it means that perhaps all of your life, you've been afraid of water and you don't understand why. Perhaps it's something that was given to you through trauma that somebody else lived in a past generation, right? There is a systemic interconnection between all of us as humans, but also it is stronger when you're part of a family. And if Richard was to come through desperation, right? And he would be like, I have this little thing, it's still bothering me. I've seen so many people. Well, I would tell him that this is actually founded in a lot of science. This theory or this practice was developed by a psychotherapist, psychoanalyst, Bert Hellinger. And he actually was a priest, then went to Africa. And meeting South African Zulu people, he realized, wait a minute, I've been working with people for years and I see them year after year after year in my office, but still they are not healed. And I come into the Zulu people, I come into their community, and when they have problems, they do these ceremonies, and I see people who are completely changed after one ceremony. And this is why he extracted this knowledge that he gained from these people to create this approach. So it's a short-term process. You do not have to sit with someone every week, talk to them. You can see someone once and go on with your life, right? Traditionally, it's a group approach because you have a system supporting you and representing your family. It could be 15 to 25 people. Sometimes it's a weekend, sometimes it's a week, but there are also other ways of doing family constellation. You can do it alone, you can do it online. I mean, the practice has evolved over years. And so the link to our people, right? What this whole conference is about is the fact that this is how our people used to heal each other in the past. And ancestral consciousness in the Zulu culture, but throughout Africa, the Caribbean, and so on, is about the ancestors and other traditions. But for this practice, we are talking about the ancestors, right? And so they believe that their ancestors are still with them, even though they have passed on. I'm seeing a lot of people nodding because this is what our people believe fundamentally, I believe, right? And they pray to them, they speak with them, they ask them for advice, and they also celebrate them as if they were still here, okay? Now, if we connect this philosophy with Western theories, there is also resonance theory from Sheldrake that actually talks about the field, the morphic field, where all the memories, ideas, emotions belong and reside, kind of like the internet of humans, right? A place where even though I don't know somebody, but somehow I have a feeling about them, where does that feeling come from? Well, that theory says that it comes from that field, the morphic field. And of course, my colleague talked about epigenetics. And what I want to mention here is that epigenetics was actually developed pretty recently, but indigenous peoples and African peoples discovered that trauma was transferred 7 generations prior and after. Okay, so past and future, from your ancestors and from the children that you will have. And these people knew that intuitively, and they've worked with that for years and years and years. Okay, so this is what I want to highlight, that even though science is proving this today, research has been done on rats, on humans, and we realize that this is actually true. And these people have been working throughout the world with this approach. And so, of course, There are a lot. If you have access to peer-reviewed articles, we invite you to go look at them, right? But since there aren't a lot of research pertaining to Black populations, we wanted to talk about our experience with this approach. Instead, to make it real, to make it believable. And my experience is actually, I was very sick when I was younger. 20 years ago, I was very desperate. I was not open at all to things like that. And it's actually a doctor that was like, hey, maybe you should start thinking about looking into alternative methods because we can't do anything. This is going to be your life. I was really in a dire situation. And finally, a friend of mine who used this approach because she was dying of cancer and she's still here today, but this is a whole other situation. She was like, maybe you should go see this group. Maybe you should go see these people. And trust me, I was really like, what is this? Like, what is this going to do for me? And they invited me and they did a constellation for me. And it worked out. I came out of it with a sense of agency. My body also got a lot of transformation.
Thank you. So for myself, 20 years after Cindy, so in 2022, it just appeared on my social media, and I was just very surprised because it was offered by a mental health professional, and I was just, what is that? I'm in mental health and I don't know what family constellation is. So I started doing research and realized that in some countries it's offered even by psychologists. So I was just so curious. I had to get involved with it. And I wish we had more time so I could share with you, everything that came for me. But one of the things that I can talk about is the fact that Cindy and I are cousins. And we, for decades, we individually, we did our family constellation. And after I did my family constellation related to family, right? To reunite the community, to get back the connection, we are here today. And I think it has something to do with family constellation, but who knows? So just to conclude, we still, now you can come back. She told you to remove your hat. Now you can put back the hat. Because we just wanted to know, okay, is it just us or is it recognized? So there's a lot of paper, there's a lot of review. But the latest one, 2022, looked at the effectiveness of family constellation therapy in reducing psychopathological symptoms. The conclusion was that findings of the study point towards the safety and effectiveness of family constellation therapy in reducing a variety of psychopathological symptoms, including depression and anxiety symptoms, and increasing general well-being. This effectiveness is especially remarkable when considering the briefty, so how it's not long-term therapy, as well as the cost effectiveness of the intervention. So when we read about this last study, we're like, maybe, it is something that we need to explore more in terms of reclaiming our joy, reclaiming our health.
And the last word, or rather question that we would like to ask you is perhaps we're going through as Black people a spiritual questioning. And perhaps we should go back to our roots to find joy and to heal ourselves rather than going towards Western mentalities and thinking that perhaps were not founded and made for us. Thank you very much.
Any questions? You go ahead, you can speak now. We have a mic.
Yes, thank you so much. I am so sorry that I didn't catch the very beginning because I was over the other side. But just before I came, here, I was telling one of my friends that I met here about what I'm reading right now. And she was showing me what she was reading. And this book is called Tradition, Culture, and Development in Africa. And the chapter I'm reading is The Traditional African Family. And I was just telling her 2 minutes ago that this is the answer to what we are looking for. We need to go back to the family unit. This was our medicine. This is our therapy. This is our clinic. And I'm just like, besides myself, I have goosebumps because I was just talking about this 2 minutes ago. I really believe that when we take a step back and we assess our indigenous ways of knowing, that we will find the answer. And that is exactly what I'm doing right now on my own for my own purposes and because I love to do like workshops for women in the Black community. It's a combination of culturally responsive therapy. And I just have to say that even in a personal aspect within my own family, I see the need for this. We need to go back to the aunties, the uncles, the cousins coming together as a unified unit. But it doesn't just mean just blasé. I mean, train them. And I think that's why I have a heart for mental health first aid. But I think that if we had the knowledge to heal ourselves, we would heal our own families because we have the motivation by blood to do so. So I really thank you for your research, and I apologize again that I only got to the end, but I'm seeing that I'm on the same track as you, and kudos. Thank you. Yeah, excellent. Yeah.
Any other question? Sure.
So yeah, thank you again for the presentation. For me, I'm just curious and wondering, how are these generational trauma passed on? I don't know if the questions.
Well, it is complex, but some of the research is showing that it is passed on through epigenetics, meaning that those patterns of behaviors, memories, it's recorded and it's passed on in a way that it's not because my father had anger that I'm going to have anger. It may show up in a way that, let's say it was anger, or with my father, it was something else with my grandfather. But for me, it's anxiety, very, very high anxiety. So what they're showing is that there's a transmission of the gene. There's no change into the gene, but there's kind of a transmission. The gene is not modified per se, but the expression of the gene is modified. So that's why it can show up in any way. But it's increased anxiety, increased depression, increased risk of mental health, psychosis. This is how it's transmitted. But, it's not to say that we all suffer from trauma, but we do have trauma in our history. Well, this is with the family constellation. In terms of epigenetics, it's not as clear that it's 7 years, but there is the proof that it is passed on. Oh, thank you.
Yeah, I know that's a complex area, and I was thinking about asking Dr. Jarvis earlier, but I think time was short. But in terms of this change in gene expression, epigenetics, is there, what studies are there to show, let's say, for example, in the case of psychosis, are there any investigative studies done to show, let's say, the change in gene expressions, let's say, in the medial frontal lobe, for example? I don't quite understand that the mechanics.
I don't want to say anything because it's very, very complex. Just for this presentation, we just wanted to show how it can be transmitted or transferred, I would say.
Yeah.
But this is.
Yeah, we didn't encounter studies that talked about the brain. It was really specifically to the gene and to the modification of the gene. They didn't go into different, really the studies that we read about genetics and how it influenced past and current generations. It was really about the genes themselves. Yeah, not the brain.
Thank you. Yeah, Dr. Shamia. Absolutely.
Thank you for the presentation. I came a bit late, but it was still very interesting. I think, I've worked, I'm a family medicine doctor, and I've worked essentially also on mental health care, but I've worked with the indigenous people, and I'm hearing what you're all saying. And I think we have to learn from you, because I think the white population, we're missing a lot of things, the family, the unity, the ancestors. I think we've pushed this aside with, I don't know if that was evolution or good evolution, but we've pushed this aside, it's me, myself, and I. So I do hope we learn from you.
Thank you. Thank you very much.